Good morning, everyone. Welcome back to another session. We have Dr. Clark with us today. Me and Gabby and Navira had a chance to talk to him, and he seems like an amazing, cool person. And I know he'll do great in the presentation today. So whenever you're ready, thank you for coming, and you can begin.
Thank you. First of all, I wanted to thank everybody from Fresh Dental Shadowing for getting in touch with me, Mahira, and these three girls, and whoever else is involved. This is a phenomenal idea, really creative way to kind of solve a very modern day problem that hopefully we won't have to deal with for too much longer. But this is great. And so my hat's off to all you guys and whoever else is involved in this project. This is a really great thing. So let me see if I can, here we go. All right, so my name is Clark McLemore. I'm a general dentist, technically, that practices in Montgomery, Alabama. Recently moved from Birmingham, Alabama. So this is kind of it's a loose framework of what I'm going to talk about. I kind of probably will ramble between subjects for a while, but I did want to talk about kind of where I came from, how I found my way to dentistry, why I think dentistry is a great profession, and one that I would not change from. And then I can also talk a little bit about owning and associating, because that's kind of a hot topic these days with corporate dentistry being so large in the States now and really around the world. It's very appealing to be, an employee. They give you good benefits and they'll offer you a lot of money, but in owning your practice, they kind of make that sound like it's something that's too hard to do. And I can kind of go into the pros and cons of that, and so you guys will have a little bit of an idea of what the future of dentistry will look like when you guys are practicing, hopefully. So I'll go back. I was born in Montgomery, Alabama, and I'm 29 years old, so I'm just a few years out of dental school. And I graduated high school up in Birmingham, actually, and then went to Auburn University. Graduated with BS in biomedical sciences, and then went straight to UAB dental school for another 4 years. Then after dental school, I actually decided that I wanted to continue learning, which I was kind of the person that was like, I'm going to get through dental school and that's too much school. I just need to be a dentist, and then I'm going to go out in the world and do my thing. And kind of, I can go into it later, but interestingly enough, I decided to go back for another year, which I would have bet all my money that I never would have done that. But I would not have traded that experience for anything. I learned more in that last year than I probably learned in all of dental school, because I had the tools necessary from dental school to really get to the next level. And that next year with some instruction on advanced topics was really huge for me. So what I did in that year was I did a lot of surgery. I placed close to 90 implants that year in a residency. It's called Advanced Education in General Dentistry, or AEGD. There's some other programs called GPRs, General Practice Residencies, that you can also do after dental school. Those are associated always with hospitals, the GPRs. But basically, AEGDs and GPRs are pretty much the same thing. It's an extra year. It's not an extra year of dental school. Every program like that has its own flavor. The one that I went to, the flavor was surgery and implants and prosthetics, kind of big stuff. Some of them are more, towards medically compromised, or pediatrics, or endodontics, root canals, or periodontics, gums, orthodontics. So each one of those programs, and I know this is kind of the next level after dental school, and most folks that might be listening to this, this isn't really on your radar, but it's something that it's great. It's a great opportunity after dental school that you can kind of have in the back of your head. But anyway, I did that, and then I went into private practice outside the Birmingham area for a year and a half, and I worked as an associate, where basically I came to work every day. I was an employee for another dentist that was in his mid-30s, and I just did my job, and it was great. I didn't have to worry too much about the business side of it. But one of my big goals has been to own. And so in the last couple months, my wife and I and our 5-month-old moved to the Montgomery area, and I'm working on purchasing a practice to own for myself. So that's super exciting, and it's been super stressful for me. So I'm glad I even got a PowerPoint put together to give to you guys. So this is what I do a little bit. This is kind of, I wanted to post these pictures here to kind of show things that I like. I am a general dentist. I do everything. I don't really do any that Invisalign or anything, although it's not too difficult to get into as a general dentist. I do fillings, crowns, bridges, dentures, but I really enjoy the surgical side of things, which really goes hand in hand with being able to do things like you can see in these pictures, which is give people teeth. You can't really give, there's not too many people that walk in your office with no teeth and say, I want teeth. Usually they have teeth that are in bad shape and they say, I need help. And with that comes surgery. And to be good at it, you can't just pull teeth. You got to do a little bit more than that sometimes. So both of these patients, the gentleman on the left, he came in, you can't see his whole mouth, but he didn't have any back teeth. He really just had some front teeth and a partial, and was unhappy with his smile. And that second picture was the same day that I pulled his teeth out, gave him teeth that same day. And the gentleman on the bottom, he came in with, I think he had 1 or 2 teeth left, and actually put a couple implants on in his lower jaw to help hold that lower denture in. And that's his set of teeth. And that was taken in the same day as well. So that kind of stuff is what I really enjoy, because I feel like it's incredibly rewarding part of dentistry. So now I need to read my own slide. So I talked about how I like surgery and full mouth rehabilitation, which, in my definition includes this kind of stuff, which is dentures, but it also includes crowns and bridges and implants with people that still have their teeth. And I like to do that stuff too. But I find myself doing a lot more of this type stuff, pulling teeth, replacing with implants and some sort of denture, to replace everything. Now, there's a question of specializing and not specializing. And I know this is probably maybe a little bit above, most of, I guess, the viewers here are probably more thinking about getting into dental school. But once you're in dental school, you do think about specializing. And one of the great things about dentistry is that you don't technically have to be a specialist in a field to practice in that field. There's no real laws that prevent you from doing whatever you want to do. Now, if you go to court, obviously there's going to be a specialist on the other side of the stand that is going to be testifying as to if they would agree with what you did in that situation. So you need to be confident in your abilities, but there's nothing that prevents you from going and taking courses and educating yourself on a particular topic in dentistry and doing that. And that's kind of what I've done. And so you can specialize if you just want to be in one area, and that's where you really want to just be a super expert. That it's a great thing to do. Or if you want to kind of dabble in different things, you can just teach yourself, kind of like I did that extra year. I didn't specialize, but I was able to kind of go into a specialist realm with implants and surgery and that kind of stuff that has let me kind of practice in my own way. So that's kind of the two flavors. You don't have to specialize to go into an area of interest. So I kind of wanted to show a few case pictures, because this is virtual shadowing, and you can't really, when I shadowed, I kind of wanted to see what was happening in the office, and you can't really see that because obviously I'm not in the office right now. I'm at home. And so I wanted to show some stuff that may kind of give you an idea of what I like to do and what I do on a day-to-day basis. So this gentleman came in, he wanted straight teeth, and he didn't want to go to the orthodontist. He just wanted me to fix them with crowns, which is the other way to do it. You can move the appearance of teeth. You can't actually move the teeth, but you can make crowns different shapes and sizes to smooth out the bite. And so on him, basically in one day, I took his teeth from this kind of jumbled up looking. He's got old fillings in there that are breaking down and teeth that are chipped and out of position. And I used filling material to what we call mock up his smile. So I built his teeth. I cut down the rough edges, and I basically sculpted out his teeth by building up and taking down into what I wanted. Once I got him to that point, which would be in between these two pictures, the first picture is when he walked in the door. I got him to where I wanted him, basically, where his teeth were straight. I had built up certain areas, had taken down certain areas, and I took an impression of that so that I could send off to the lab and say, this is basically what I want his teeth to look like. And the picture on the right is when he came back and I put his crowns in. So that was 2 appointments. One was working on him. Second appointment was cementing these 4 crowns in the front, and he was ecstatic. And that's really rewarding to be able to have the skills to, I didn't just drill on his teeth and send it off to the lab. There's a lot of thought and planning that goes into that you can do. So this is kind of what I would consider kind of the artsy side, the design side, the cosmetic side of things that I enjoy doing on a day-to-day basis. This gentleman came to me, and he had obviously had some problems. This bridge he has on the front was moving significantly, and that was really the only thing that he had left that made him look like he had a smile. And he broke off this front tooth, you can see, that snapped off of the gum line, and as I'm sure you can tell, his teeth are not in good shape. So what I actually did on him, and I didn't post the surgery pictures, but I actually placed 5 implants on his upper jaw. I took out all those teeth at the same time, and you guys may have lost my screen. Can y'all see my screen again? I think I had a pop-up.
Yeah.
Okay.
Yeah.
Okay. So I placed 5 implants on the upper, and I had him in some temporaries. And this picture on the right is his final. That's called a fixed hybrid prosthesis. So that's the same material that we make crowns out of, zirconia. That is one huge piece of zirconia on the top that has the gums painted on there, and it has all the teeth. They're all connected, and that is screwed onto all 5 implants. And this is something that they don't teach you in dental school. This is something that I was able to learn when I took that extra year, and something that I really, really enjoy, because I was able to get, this is something that is significant rehabilitation that takes a lot of planning and training to be able to do. And I absolutely love doing stuff like this, because this is something that doesn't come in and out. It's screwed in there. It's very expensive, but it basically is the closest thing to a patient having their real teeth back again. This is a dental implant. This was a case that I did where a gentleman had a tooth that was broken down to the gum line, was not fixable. And this is an example of how I was able to, the picture on the left, that's my implant drill, and the roots of his tooth are still in there. I have not taken them out. I actually drilled straight through the tooth that he had, basically made my hole for my implant, and then I took the roots out. And on the picture on the right, you can see where the roots used to be. I put some bone graft material where the roots were, and that implant is right in between those 2 roots in the bone that goes between the roots. And on top of that implant is what we call a custom healing abutment. So what I did was, that tooth came out, there was a particular shape to the gums there. I put this little post in there, and I used filling material to fill that space back out, so his gums never change shape during the healing process. Obviously, well, I say obviously, to a dentist it's obvious, but you can't put weight on a dental implant the day it goes in most of the time, especially in the back on molars like this. They take a lot of force, and if you put that implant in and start putting weight on it, you can cause it to fail. So he doesn't actually bite on this thing you see on the right, but he healed up in that, and it really made a beautiful, beautiful outcome. It made it super, super easy. When he came back 3 months later after this procedure, all I had to do is, you can see that, can you guys see my mouse at all? This has a screw
Yeah.
that goes into the implant. I just unscrewed this. I put a little post, an impression post on here, took an impression. The lab made the crown within 3 weeks, and I screwed it down, and it was perfect. Really easy process after that. So this is something that, I mean, I was so happy this day that I did this. I love doing stuff like this. And this is some bonding. So this young woman came to see me, and she could barely smile. She had bad cavities, as you can see. I posted the picture in the middle there of after I had just taken the cavities out of her teeth. She didn't want to smile. I barely could get her to show her teeth, and that's something that I see with a lot of my patients that have been dealing with dental issues for a long time. Is they literally forget how to smile because they haven't done it in so long. And so she came to me. She had all these black spots and holes in her teeth. And in one day, took the cavities out of her front teeth. I bonded it back. And then the picture on the right, it's a little bit bloody, but that was immediately after I finished her fillings. And she was so happy. You can see the difference in her smile. I had just showed her, I had handed her a mirror and let her see her smile. And you can see how much bigger her smile is on the right. And that's something that is super rewarding to me. Being able to work on people's front teeth and immediately let them see something, you know, that they haven't seen in a long time. That's awesome. And that's, you know, this is another day. Really, what I'm showing you guys, these pictures are those days that I'm giddy. I love my job, and I'm thinking, you know, this is what it's all about. So this is one of those days that she was so happy. She wrote a nice review, and it really changed her, you know, thought about her own appearance, made her want to smile again because she didn't have these black spots. And this is bloody picture. I got to post a bloody picture because if you guys want to be a dentist, you're going to see some blood at some point. So what this is it's another thing that they don't really teach you in dental school. This is something I learned in my extra year. This young lady, she was 22 years old. She had been missing this lateral incisor her entire life. It's extremely common. You probably know or see people without knowing that are missing one or both of their lateral incisors since birth. They just never grew them. It's incredibly common. But she has gotten to the point where she's old enough that she can get a dental implant. She's in braces, as you can see. She doesn't have a wire on there, but she's got brackets. I was working with her orthodontist, and what I did was, because she never had a tooth there, she didn't have enough bone for an implant. It was very, very skinny. And so we have to grow that bone back. So what I did is this picture over here is before I started working. I had just made my incision. This is actually her jawbone right here. This is not her gums. I drilled holes in here that you can see are bleeding. And that's what's going to bring blood into my bone graft to start the healing process and turning that bone graft into her own bone. I also, on either side of her teeth here, I drilled some more holes. And that was actually for the orthodontist. When you do that, you initiate the healing process around those teeth, and an orthodontist can actually move those teeth faster. It's called RAP phenomenon, rapid acceleratory phenomenon, where if you do damage to the bone around teeth, it causes the healing process is happening, the bone is remodeling, and teeth can move faster orthodontically. So it was kind of fun to work with a specialist. And he said, well, while you're doing your surgery, could you put some perforations on either side of those roots so that I can move them faster and get them out of your way? The roots were like this, and I needed to place an implant in the middle. So I put these little holes out here, and he was able to straighten those roots up. So I've got room. That was cool. And then this on the right side is bone grafting material. It's donated human bone that's been cleaned and ground up. And you place that, and it's just like dry grits with water in it. And this little thing that's hard to see is a membrane, is a collagen cross-linked membrane that prevents the gum tissue from being able to grow down into that bone graft. So it protects the bone graft up against your bone while this bleeding happens. And eventually 3 or 4 months later, this turns into solid rock bone. And we've grown her bone back, and I was able to place an implant and give her that tooth. But it takes a long time to do things like that. But this is, you know, another thing that I really enjoy doing. Here's some more bonding. And this is more of that feel good stuff. Both of these patients, this was done in one day, freehand bonding, just filling material on teeth and, knowing dental anatomy and, putting it on there, trimming it up, adjusting the bite. Both of these patients were super thrilled. I was able to take them from, these teeth were not straight. As you can see, everything's got an angle to it. I was able to straighten that up some. In this patient, she had discoloration from tetracycline, antibiotic when she was younger. It was used a lot for ear infections back in the 60s. And so there's a lot of, 40, 50, 60-year-olds these days that have had this tetracycline staining on their teeth. It sticks in the teeth when they're growing, when you got your baby teeth in. So I was able to bond her teeth up, fill these gaps, get that discoloration out of there. And I was able to straighten things up and fill out her spaces. And that's awesome. That's super rewarding for me to do during the day. I don't get to do it all day, every day, but when I do get to do stuff like that, I really feel good. Okay. So I know I kind of talked about my work history already, but I guess I'll go into what kind of drove me into dentistry. So when I started at Auburn, I first was thinking that I wanted to be a forester, a wildlife biologist. I really like the outdoors. I'm a big hunter, fisherman. And so I thought that's what I wanted to do. And I kind of realized that the job market wasn't great for that, and that I should probably do something that afforded me to do those things that I loved in my free time instead of doing them every day of the week. So I moved on to pre-med, and I was pre-med. I was trying to figure out what I wanted to do. And the problem that I was having was I could not figure out in my mind. I needed to picture myself in the future of what I was going to do. And I realized in medicine, you don't really know what you're going to do. Are you going to be a surgeon? Are you going to be a internal medicine? Are you going to be, those people's days look completely different, and you don't really know exactly where you're going to end up. Sometimes, if you're not competitive enough, you may not have much of a choice of what your career really ends up looking like. And that always didn't sit well with me, because it was hard for me to grab on and find the motivation to study for these hard tests when I didn't really know what I was going to end up doing one day. And so I think it was my sophomore year at Auburn, I finally went back home and I went to my dentist. I had not gone to the dentist in a year and a half. And I go back and I've got 5 cavities. And so he's like, well, I've got an opening tomorrow. We need to get these filled. And I came back and he filled them. And I think it was right before the appointment. I said, do you have people shadow you? And he said, oh, absolutely. And I said, well, I think I was off for Christmas break or something. I said, well, would you mind if I shadowed you? I'm just kind of curious about it. And he said, sure. And so anyway, I'm sitting in the chair. He gets me numb, and he grabs the patient mirror before he starts drilling on my teeth, and he hands it to me. He says, I want you to watch me do this. And I was like, this is a test, because nobody wants to watch their own teeth get drilled on. So I wish I could say that I loved watching my teeth get drilled on, but I actually didn't. It was kind of nerve-wracking. But I started shadowing him the next week, and it didn't scare me off. I guess that's the important thing. And I shadowed him the next week, and he had such an energy for his career. Every patient, he had just the nicest conversations with him. He was so excited to come to work every day. He had just a great work atmosphere. And I was able to kind of see through him, shadowing him, what, a truly enjoyable career could look like. And that's kind of where I started my journey of wanting to be a dentist. Other than that, I always liked working with my hands. I liked to dive into the details of little projects after school. In middle school and high school, I'd build something. I was never anything impressive, but I would just spend my time, tinkering with stuff. I like the little detailed stuff, and I also, like building big stuff. And I kind of liked art, but I was never that great of an artist or anything. So all those things, I started kind of putting the pieces together and saying, my interests and my things that I like to do sort of align with this career. And so I just kind of started thinking more about it, and eventually switched to pre-dental. And I really haven't looked back since then. The things that I love about dentistry, um, for one, you can kind of make what you want out of it. You can dive, like I was talking about earlier, you can dive into different aspects. If you want to be a surgeon, you can be a surgeon and a general dentist at the same time. If you want to be uh, if you want to be real artsy and cosmetic and aesthetic, and really get into the artistic detail of things, you can do that. And you can do it a lot if you want to kind of form your career around that. So that flexibility in what you can do you can tailor your career to be something that you enjoy doing every day. You also have flexible hours, and what I mean by that is, uh, dentistry is a physically demanding career. You are leaned over, your neck is like this all day long, and you try your best to sit up straight and everything. But when you're in the nitty gritty of it, sometimes you slunch over and your back hurts sometimes, and your shoulders hurt, and your neck hurts, and your eyes, may get tired. You may get a headache, some days, but um, typically dentists are working 4 days a week, and you can still make a very good living working, 4 even less days a week, because we're a career that's in high demand. And fortunately, we are compensated fairly for the hard work that we put in. And so that's really great to have that extra time that you can spend with your family. um, and you're not having to work 5 days a week. I've As a dentist, I have not worked since residency. I've not worked 5 days a week. And honestly, if I did, it would be really, really difficult. But that's part of the good thing, is you don't have to. Um, an orthopedic surgeon is going to make great money, but they're going to be away from their family a lot, from what I understand. And there's a lot of other, medical professionals that are like that, and dentistry doesn't have to be like that. You can work, part time and still make a good living. Uh, Financial security, I think I kind of touched on that. Dentistry is a financially rewarding career, that even if you're an owner or if you're an employee, you can make a healthy living that'll afford you kind of whatever lifestyle you want to live. And helping people is huge, and that's why I kind of posted those pictures that I showed earlier on those slides. Is that kind of is the essence of what I enjoy doing. My worst day, in my opinion, would be a day where I was doing fillings on back teeth all day long, because nobody leaves the dentist and goes, "Thank you so much for those fillings on my back teeth. Um, I'm so glad that you got rid of my cavities." And I know that people think that there's a lot of people that do that all day, but that would drive me crazy when I have to do a bunch of fillings on back teeth, even on front teeth. Sometimes, if it's not something that a patient can see, it it doesn't do much for me. It's not very rewarding. You're helping people, but I really like giving somebody a smile that they haven't had in a long time, or maybe never had in their life, and being able to see their reaction to seeing themselves, and being able to go show off their smile again. I saw a patient of mine from my residency popped up on Instagram as a potential friend, and she had my teeth in. They're her teeth, but I made them, and it's like kind of crazy to see somebody out in the world, posting pictures of themselves with something that was your creation, kind of. And that, she before that she had no teeth, and so that is just, you can't replace that feeling. And so helping people is huge, huge. And also, the on another note, being able to devote your services, through mission trips, through charities, being able to provide a service that is unique and difficult to find in some places. that's just as rewarding. Being somebody that can be really special for a lot of people. When I was in dental school, I went on a mission trip to Honduras, and it was life changing for sure. I mean, we just pulled teeth, but man, they don't have anybody that can do that around there. They don't have the money to afford it. If they could drive and pay for it, but most of them have no money. So, helping people like that is just awesome. It's really awesome. So I'll move on as far as owning or associating. So the current climate in dentistry is you still have your small groups and your single practice or single practitioner offices that probably most of you guys have grown up going to, where you've got one or two dentists. They may own a few offices, but they're still privately owned offices, and that they are owners, and they may have associates underneath them. But that's kind of the older, that's the traditional way of that dental practices have run. Now we have the flip side of the coin, which is the corporate dental, which is your Aspen Dental, Heartland Dental, these huge corporations where nobody is an owner, everybody's an employee. You have to follow the rules of the corporation. Some of these corporations were not started by dentists. They're not currently run by dentists. They're run by business people, and business people think differently than a dentist does about the way that patients should be treated and what treatment should be given to patients. And that doesn't sit well with a lot of dentists. In the middle, not that it's super important, but in between your privately owned practice and your corporate practice are these what are called DSOs, dental service organizations, that are typically, they're basically small corporate chains that can be anywhere from 4 or 5 to 25, 50 offices that are usually more, it's kind of like the corporate thing, but more on a little bit smaller level, regional level, maybe state level. And some of those you are able to actually purchase into the group. As you can start as an associate and they'll let you buy in a little bit, but you can never be a majority owner. The corporation that you work for will ultimately always own the majority stake in your practice. So you can never ultimately make all the decisions that you want. But that's kind of the middle of the road. So the benefits of being an owner are that you get to make your own decisions. You get to hire who you want. You get to treat your team the way that you want. You get to be the kind of leader that you want to be. But the downside is that you have to learn how to run a business. And that's actually what I'm doing right now. And it's super, super stressful because not only do they not really they don't teach you really anything about running a business in dental school, but you don't have time to learn how to run a business in dental school. You're trying to figure out how to do dentistry on a level that you're not going to hurt somebody when you get out of school. And so you get out and you've got to, I wish I could go back, almost wish I could go back to college and take business classes because how much there is to learn. And so that's really stressful. But the flip side of it is that you have a much better income as an owner. And in today's environment with so many corporate offices out there with so much money to throw at pre-dental students and dental students, they do a really, really, really good job of making it sound like being an owner is too hard, it's not worth it, and that they can pay you a good salary, which they can. I would say these offices will offer you anywhere from $150,000 to $200,000 guaranteed a year. And to somebody that's coming out of school with $100,000, $200,000, $500,000 in debt out of dental school, you're thinking, yeah, that sounds great. That's what I'm looking for. And they have so much money that they make that sound like that's got to be the standard, that's where you need to be. And they kind of hush away that if you do learn how to run a business well and you stay busy, that you can make 2 or 3 times more than what they can pay you pretty easily. And they don't there's not a lot of talk about that, because your private dentists, they're the ones that are out there in the world making a lot of money, and the corporate offices are the ones sending salespeople to your dental school telling you to work for them for $150,000. So, the benefit of working for that corporation is that you don't ever have to think about anything. Like when I was an associate, you show up to work, you do your job, and you go home, and you don't have to worry about, you need to call your patients and check on them, but you don't have to think about hiring and firing. You don't have to think about what supplies you're ordering for the office. You don't have to worry about paying bills. You just, collect your money, you go home, sleep at night, go back to work the next day. And so, some people want that. I always wanted to be a practice owner. I always kind of want to challenge myself. And that's another challenge that I don't want to settle without. And so that's what I'm working towards right now. And so that's something that, in the future, you guys can kind of think about. And I would definitely suggest thinking really hard, if and when all you guys are in dental school. I'm sure everybody will get into dental school. When Aspen Dental takes you to Top Golf or takes you out for drinks and dinner, and they're explaining all the benefits, that you remember that there's another side of that coin, and that all the benefits they can offer you. Sorry, I think this thing I keep getting pop-ups. That here, I'll just come over here. Go back down to where I was. But there's another side of that coin, and the ownership side. Nobody's going to come really lobby that to you guys, because they have no reason to. They're out there owning a business and making money for themselves. They have no reason to go to a dental school and explain the benefits of being an owner. So know that you'll have a kind of a one-sided view of it coming out of dental school. But I encourage, everybody to, if that's what you want, to not settle and seek ownership if you want to. Okay, let's see where we're at here. So we're kind of towards the end. Again, I wanted to extend a huge thank you to everybody with the Fresh Dental Project for doing this. And I'd love to answer some questions if anybody has any. I kind of popped on here a few things. I took myself back to dental school or pre-dental era in my mind, and threw some questions on here, things that I was really concerned about when I was in you guys' position, and to maybe spark some questions from anybody. So what questions does anybody have?
Awesome. Yeah, we do have a list of questions. And first off, thank you so much for such an amazing presentation.
Thank you.
We can definitely start off with like the DAT and like dental school applications, maybe like your advice and your experience, and then we can move on to like dental school specifically.
Sure. The way that I prepared for the DAT was I actually paid for one of the Kaplan courses. And I know they have several different ones. They have an in-person, they have an online, and an online self-directed, I believe. They may be different now. But I paid for the online self-directed course. So it was you pay $1,200. It's a do-it-yourself. They have the curriculum, but you do it at your own speed. And I took, I think, a Christmas break. It was like it maybe extended past that, but it was 5 or 6 weeks. I took that curriculum and I just chunked it down into day size pieces, and I tried to follow it to a T. And my goal was, I'm going to take the DAT one time, and that was my goal I set for myself, because I knew I had to push really, really hard. And if I told myself maybe I can take it again if I don't do so well, I wouldn't have pushed myself hard enough. So it was like I was training for a marathon. It really is a mental marathon. And you have to train yourself. You have to train your mind to be able to handle that much thinking for that period of time. And I thought that the Kaplan course did a really good job. And that's just what I did, but I thought it did a really good job of kind of preparing me. in the sections, and also the test or the sample test that you take. You time yourself, you put earplugs in, you sit by yourself, and you take a practice test. And you do that over and over and over. It's like going on a run, training for a marathon. The first couple times I did it, I started, you're on the clock with everything you do. And some of those sections are designed to push your mind by making it so fast that you don't really have time. The average person doesn't have time to get through the section and be able to really sit down and think about the question. So you have to be able to find shortcuts, and you have to be able to build your mental stamina up to be able to handle it. And I was wiped the first couple times. Like, I would run out of time on sections, and I just, I was like, I don't know how I'm going to do this. I was totally drained. My brain, I couldn't hardly form a sentence when I was done. And you do it, 3, 4, 5 times, as many as you need, until you're a machine. And that test is it's a game that you've already played multiple times. And when you get in there in that room, you're just doing it again. You've already practiced. You already have your game plan lined out. When I hit this section, this is what I'm going to do. When I hit this section, this is what I'm going to do. And you have to learn little strategies along the way. I know the reading comprehension section. I don't know if I'm assuming the format's the same way. It may be different now, but there was like a reading comprehension section, and there was a particular way that you had to do that I learned through the course of how you break it down. It was not something that I would have figured out on my own, but it's something that they said, do it this way. You're going to have to, go through these steps, and you're going to break these questions down really quickly. And so stuff like that, I just had to practice. So my advice would be to find a good way to prep. Everybody preps differently, but that's how I like to do it. I made myself a schedule, and I tried to stick to it. And I studied for probably about 3 or 4 hours a day. That's all I can really handle. I can't study all day, every day. So I would wake up in the morning, and I would do my 3 or 4 hours, and then I'd go do something enjoyable in the afternoon. And I just did that day in and day out until I was ready to go. And fortunately, I did only have to take it one time. And I got a 20 on it, which is not spectacular, but it was good enough. And I wasn't going to argue with it. So that's how I prepared.
Awesome. Thank you. So the next question kind of has to do with your overall experience in dental school, and I guess, how did you survive dental school, and just a little bit about that?
So it's super scary. Even when you get past the DAT and everything, when you go to start dental school, it's like you're standing at the bottom of Mount Everest. And I remember so clearly that feeling of oh my gosh, they let me in by accident. I'm not supposed to be here. Somebody screwed up my paperwork and let me in, and I'm going to fail immediately. And everybody here is smarter than me. And the truth is, when you get into dental school, every single person in your class is all doing the exact same thing at the exact same time. And I didn't realize the benefit of that, because when you're in undergrad, you may have a friend or two that are in a couple classes with you, but ultimately you all have your own schedule. In dental school, you have the same schedule with the same people. I mean, some dental schools are different, but at UAB, we have one class, and everybody goes to the same stuff at the same time. So every test, everybody's studying for at the same time. People would share study guides with each other. You could get in study groups, but everybody's going through the same thing. And that has such a huge value that I didn't know till I got in dental school. And ultimately, it's kind of like you get forged in the fire a little bit. You don't have to exactly know how to do it going in, but you will figure it out. You'll do it the wrong way, and then you'll say, I can't do it that way again. That took me too long to study, and it wasn't efficient. And it'll happen because you have to, and you'll do it your way. And then you'll see your friend doing it a different way, and you'll say, I'll try it that way next time. And you'll do it that way and say, well, you know what? I think I can tweak this a little bit more my style and do it my way. And so, I was not super duper organized in undergrad in terms of studying or anything. I don't think I did anything extraordinary, but when I got in dental school, I just found a way to study. I would take the PowerPoint slides. I would take all the text off the slides. I would just copy it, paste it onto a Word document, and I would just I mean, you have thousands of slides sometimes for a single test. And I would have it on this giant Word document that would be 50, 60 pages long. And I would just go through that and I would just start organizing it on the Word document, little at a time. And I would go through it maybe 2 or 3 times total is all I'd have time for. And by the time I got right to before the test, I would have it so organized. I'd have things highlighted. I'd have it all in the format that I wanted, and I would have learned it by then. So that's just, you don't have to know how to do it. If you get into dental school, you have, a 99% chance that you're going to be perfectly fine and you'll figure it out. But everybody, you just got to kind of roll with it. It's stressful and you just get in there and do it.
Awesome. Thank you. So our next question kind of has to do after you have graduated from dental school, and kind of how difficult was it finding a job like right after dental school, and does having a residency increase your chances of finding a job?
That's a great question. Right out of dental school, it's really typically, it depends where you're wanting to work, but it's usually pretty easy to find a job as a general dentist. When I got out, because I did an extra year of training, I kind of had this particular set of skills that I wanted to do. And that means I need to be in kind of a particular area. And I also need to be kind of at a particular type of practice. It's not super easy to go into a practice that is just doing fillings all day and they do Zoom whitening and start placing a whole bunch of implants. It just doesn't really work like that. You may get a couple, but you kind of have to find a practice that sort of fits what you want to do in the first place. So it was actually a little more difficult for me to find a job after I finished my training. Although I was doing what I wanted to do, it was a little harder for me to find a practice that fit my style. And that's why ultimately I ended up moving to Montgomery, was because I found a practice that really fit exactly what I wanted. A lot of implants, a lot of surgery, kind of, a little bit of the higher end type, larger procedures, and decided to make a move for it. But generally, if you just want to be a general dentist, it's usually not too hard to find a job somewhere out of school. You can go work for corporate out of school. You can find a job with corporate dental office just about anywhere. And you can do that for a couple of years while you just kind of figure out what you want to do and, start paying your debt off. It's hard for me to speak too much to true specialists, but I know that I have some friends that are, orthodontists and other specialists that, tend to have sometimes a little bit more difficulty finding jobs just because there are fewer specialty offices than there are general dental offices. So everybody's different. That's part of the reason why you network when you're in dental school as much as you can. Now, it's not as hard as it sounds. You don't have to go out there and try to meet a bunch of people. They will come to you. There's some large dental supply companies, Patterson, Henry Schein. They're, depending on what part of the country you're in, there's some regional ones. They will come to you. They'll buy you beers and dinner and lunch, and they will introduce themselves to you, and you introduce yourself to them. And those same people that one day will sell you dental supplies, you can call up and say, hey, I'm looking for a job. And they'll say, all right, well, I've got 80 clients in your area. Let me ask around for you. So don't be afraid of if you're a little bit on the shy side of the networking stuff. It falls into your lap. You just say, hey, and keep their card and keep their phone number.
Awesome. Thank you. So the next question kind of has to do with residency and how your specific program worked, and in general, how does a dental residency work? I know how a medical one works, but how would a dental one work?
It's similar. Most are on the match system, which has just happened on Friday for, I'm sure all you guys know, or it happened for medical residencies. And so the program that I was in was match, and most of them are match, but some are not. Some just, I guess, do it their own way, and they'll just give you a call if they accept you or not. I don't really know why or why not they would choose to be in the match program, but that's how it worked. I applied. I visited my residency several times beforehand. I applied to the match, and they accepted me on match day. They told me beforehand, like, list us number one because we'll list you high, because I had been there a few times. But everyone works totally differently. And I can't speak too much to the specialty residencies. I'm sure they're a little more gung-ho about the rules and, good luck to you kind of thing. Rank us where you want to rank us, and we'll rank you where we want to rank you, and you'll end up where you end up, kind of like a lot of medical residencies are. In my situation, the match was kind of a formality. They selected really based on you visiting the residency, getting to know the current residents, them getting to know you. It was more of a friendship, working interview type situation more than it was truly a match situation. But there's a whole spectrum, and I think each one is going to kind of, do it however they want to, whether it be very formal or very informal like mine was.
Awesome, thank you. So the next question kind of has to do with, you discussed a lot of implant cases, but is there ever like a case or something that you don't feel comfortable doing that you might refer out, or is it like, okay.
Yes, absolutely. I like pulling wisdom teeth, but sometimes I get a little weirded out with them. They can really be a day ruiner for you. And so sometimes there are wisdom teeth that I'll say, I don't want to mess with these. It's going to take me way too long, and I just don't feel comfortable dealing with it. So I will refer some wisdom teeth out. I have been in situations with implant stuff that I didn't feel comfortable. Somebody needed extensive bone grafting to a point that, I was not comfortable with, like, basically jaw reconstruction type bone grafting. And I was like, you don't want me throwing a stick at this thing because it's over my head. So absolutely. And there are situations during my, daily life where you run into stuff that you may never have seen before or never had to deal with, and you have to figure it out on the spot. I mean, I can be doing a surgery, placing implants, have the whole lower jaw opened up, looking at the bone, and I'm going to town on it, smoothing it out, and all of a sudden I hit a blood vessel in the bone, and all of a sudden it's doing this, squirting out, across the room. And that happened to me one time for the first time, and I had to figure out what to do with it because there's nobody else there that's going to help. And the farther you get, and that's another thing that my residency taught me, was to kind of go with the punches, roll with the punches, and you kind of that you can solve problems. You just got to figure it out. Same way that you guys started this fresh dental shadowing. You see a problem and you come up with a solution, and you use the tools at your disposal, Zoom, and you figure out your way through it, and that it works the exact same way.
Awesome, thank you. So the next question kind of has to do with private practice. Since you are opening one up right now, what's kind of like the process? Like, how do you even begin to open a private practice, or like what tools?
Oh, it's crazy. It's crazy. So there's a few ways you can do it. You can you can do what we call startup, where you open your doors for the first time, and that involves you have to get a big loan from a bank. You have to find a building and get a loan for the building. You got to get a loan for all your dental supplies and equipment, which usually goes with your practice loan. Then you have to work with a supplier, and there are many suppliers that you will meet through dental school that like Patterson Dental Supply, Henry Schein Dental Supply, Atlanta Dental Supply, Nashville Dental, Benco Dental. All these places, you'll have somebody's phone number. You can call them up and say, hey, I want to start a business. And they'll say, well, we've got everything you need to start a business. You're going to pay us this much money, and we will design your building. We'll help you with the loan stuff. We'll walk you through this, and you can pay them for it. You can also, if you're savvy enough, you can do some of that stuff yourself. You can get your own designer and, whatever. But that's a startup. The way that I'm doing it is probably a little bit more traditional, where I'm purchasing an office from an older dentist. And that can work in a couple ways. You can work as an associate for a year, 2 years, 5 years, and then partner with that older dentist, and then they phase out after a few more years. Or what I'm doing is I'm coming in for a few months, getting the ball rolling, learning how the office works and all that, and then I'm just buying him outright, and he's gonna hit the road. And so that process works where we've hired a company that specializes in dental transitions. Again, you pay them a whole lot of money, and basically their job is to be a moderator between you and whoever you're buying from. And they also help work through the financing. They put you in contact with lawyers to go over contracts with and all that stuff. So you kind of find, typically, you can organize your own team. I've just never quite been, maybe I'm not smart enough, savvy enough to do it all myself. So I prefer to kind of find somebody that knows what they're doing, that you can pay to help you out, that can be on your side. And that's what I've done in this situation. And then you can also, like I was saying, you can partner in, and that's basically the same way, where you purchase a portion of the practice from whoever owns it. You co-own it together for some period of time, and then eventually you purchase the other portion of it when they're ready to get out, and then you own it.
Perfect. Awesome. Kind of going off that, well, I know you're not doing a startup, but I don't know if this applies still, but how long does it take to actually make profit, if that makes sense? Because obviously you're putting a lot of money in for a private practice.
Mm-hmm.
Well, at what point will there be profit, or how does that kind of work, if that makes sense?
Well, it's hard for me to say for sure. I have one of my best friends and his wife are doing a startup, and they're 6 months in right now, and I haven't asked if they're making a profit yet. But from what I've heard, usually around the year mark is when you really can kind of, start to get some momentum going. I'm sure every practice is different. The benefit of buying an existing practice and transitioning it as smoothly as possible is that you're probably paying more for an existing practice because you're buying the patients. If you're doing a startup, you're just buying the equipment. You're not buying any patients. And so you have to buy those patients of record, and they have a value. And that value is based on how much money that practice has made in the last usually 3 years. They're going to average that out, and usually you're going to find a percentage of that number. The practice has netted $1 million average over the last 3 years. And so we're going to value the office at 70% of that, or whatever, 50%, 60%. So you have to buy the patient base, but the flip side is that you're making money on day one, because you're not stopping operation. The business is already going. It's already making money. The train is rolling down the tracks. You are just hopping on. And if you do it smoothly, which is what we're attempting to do at my office, you transition one out and one in, and you stay on that train, and you keep the cash flow going, so that although you have a little bit bigger loan, you don't have a significant drop or time to get off the ground with the revenue.
Awesome. I think we have time for one more question. So
Okay.
kind of going off of the private practice kind of topic now, in the future, do you see private practice growing more, or in comparison, where do you see corporate dentistry going, both in their parallels?
Yeah. I see corporate dentistry getting bigger because they've got advertising budget, and they have the money to go advertise to pre-dental students like you guys, and really dental students, and when you're in residency, and that's something that wasn't done years and years ago, but now is really done. So that kind of goes back to what I was explaining earlier, is when you're in dental school, you'll have tons of corporate offices come buy you things and talk to you and be friendly. And that's what you see when you're in dental school, but you don't see private practice doctors. They have no reason to come to dental school and buy you lunch and schmooze you, because they're, like I said, they're out there making money for themselves. So what that's doing is it's just selling corporate dentistry to dental students every day, every year, it's pushing more people into corporate dentistry. Whether that's good or bad, I don't know if I'm one to say. Obviously, I'm on the private. I would prefer private ownership, but because of that fact, I think that corporate dentistry is going to continue to expand and grow, which I kind of think it's unfortunate because, especially Aspen, I've heard a lot of things. I had a lot of patients come from Aspen with a lot of complaints about the treatment they received, and I've heard complaints of dentists of how they're told how they need to practice and what decisions they need to make, and it's not right to tell a doctor how they need to treat their patients or what decisions they need to be making on behalf of their patients. That doesn't sit well with me. It doesn't sit well with most people, but anyway, there's good and bad to it, but I definitely think corporate dentistry is going to continue to grow.
Perfect. Thank you. First of all, thank you so much for the presentation and like the amazing question and answer session.
Thank you.
That's all we have for today. So once again, thank you so much. And yeah.
Real fast.
Mm-hmm.
One more slide. This is my Instagram and my email. If anybody has any questions, feel free to email me. One of my favorite things is talking to people that have gone through the path, same path that I took, and I love talking about it. I love helping people out. I've kind of like mentored a couple people that have gotten into dental school, and it's really rewarding to help out. And part of the reason why I wanted to do this. So that Dr. Mac Dentistry, that's just bloody pictures of stuff that I do. And but if you have any questions or if there's anybody that watches this or is watching right now that is in the central Alabama area, maybe not, that wants to come shadow me, feel free to shoot me an email. I'd love to have anybody come to my office and see what I do.
Awesome. Thank you. Yeah. So make sure to follow him, contact him, especially if you are in that area. That's amazing. So that's all we have to say today. Thank you so much for tuning in. And yeah.
Thank you guys so much. I appreciate it.